Having a conversation about the NHI and how it will benefit South Africans. Professor Sylvester Chima, if I can bring you in here. On Thursday, the Minister was speaking about the NHI bill. As it stands, what's your opinion on it? Does it work?
Well, let's start with the positive aspect of it. The positive aspect is that the idea of the NHI itself is good in principle. It's good in principle because what it does is it recognizes the constitutional requirements that the right to health should be progressively achieved within the population. It also recognizes the fact that about 20% of the population are using private healthcare facilities which they cannot afford, while 80% of the population is confined to using public health services which are under-resourced and with infrastructural deficiencies. Now, the problem that we have with the NHI as proposed is that one is afraid that the inefficiencies that are inherent in government services will be somehow translated into all the healthcare services and therefore bring down the quality of healthcare services that we're even having for the private population. So the challenge that we have is here. How is the NHI going to be implemented in such a way that it actually doesn't compound the problems that are already very, very prevalent in the public healthcare services? In other words, if we implement the NHI without improving efficiencies within the public health service, will the quality of service actually not degrade? And so that, it compounds the whole problem. So this is the challenge that I see with the implementation of the NHI. So the government, in my opinion, should try, rather than just trying to implement the entire NHI as a one-go or one-step process, even though it's supposed to be phased in, they should try to get the efficiencies, or at least get assistance from the private healthcare services who are already running a semi-efficient system and get them to help with the implementation of the NHI. That's how I see it at this particular point.
Professor, one of the issues in our healthcare system is that it's terribly underfunded and under-resourced, isn't it? In terms of attracting new talent, how can we do that?
Well, in terms of attracting new talent, that's exactly part of the problem. As Dr. Pillay from the National Health Department has said, one of the problems that I've identified is the absence of human resources. So if we are already having human resource deficiencies at this particular phase in the, so when we implement the National Health Service, how do we plan to actually overcome those human resource deficiencies? The human resource deficiencies are caused by, not enough specialists being trained, and not enough of the qualified specialists actually trying to stay in the public health service, as evidenced by the recent challenges in oncology practice. We're not producing enough specialists in South Africa, and some of those who are produced would rather prefer, because the system is inefficient, they are trying to transfer their services either from the rural to the urban areas, or they actually live in the country. So the challenge is this: how are we going to increase the number of specialists who are actually going to help us to run the NHI efficiently? That is one problem. So now, probably one of the things that need to be done is that we need to increase the number of medical schools. We need to increase, the efficiency of ways we are producing specialists. We need to, maybe improve in terms of remuneration for specialists to encourage them to actually, people to stay in the service and actually train, or be willing to undertake the risky specialties like obstetrics and gynecology and neurosurgery, where people are getting sued a lot because of medical negligence claims. So these are some of the things that need to be corrected within the current system before the full implementation of the NHI. Like I said initially, the idea of the NHI itself is a good idea because it's a constitutional mandate and also a global mandate, for example, to improve the quality of healthcare among vulnerable populations. But if you have a system that's already partially inefficient, like the public health service, and you compound it with the overload of new services or new regulations that are supposed to be saying, then what you're going to create is a system that basically may implode upon itself. And therefore, there has to be care in terms of implementation. We have to improve the number of how would I say it? Human resource, quality of human resources. We have to train specialists, we have to train more doctors, we have to train more nurses, and we have to train them better and provide the infrastructure they need to provide better services before actually we go ahead to start to try and implement the NHI.
Professor,
that's my opinion at this particular
point.
Yeah,
you touched on something very interesting with regards to malpractice litigation. In terms of malpractice, medical malpractice litigation, how is it undermining the health system in South Africa?
Well, the problem is that, as a people from the National Health Department would probably agree, one of the challenges that we have with the current healthcare system is that there is, for example, there is a backlog of payments that need to be, individuals that need to be compensated, and a backlog of cases occurring due to medical malpractice claims. Now, if you have a system where there's about 22 billion in backlog of payments or anticipated payments over a period of time in certain provinces, and we're talking about one province, for example, Gauteng, which has a very large case numbers. Also, we have the same problem in KwaZulu-Natal to a certain extent, and the problem also in the Eastern Cape. So you have this backlog of amounts that need to actually to be compensated. Now, if we introduce the NHI, for example, without settling these claims or without producing a system how we are going to settle claims that will arise, because one of the things you are going to realize is this. Now, once we have more individuals accessing private healthcare services, also because the system is overloaded because of overwork, we're going to find out that there will be more claims created. People are going to be claimed because people are more aware of their rights, and they're also more entitled to those claims. If anything goes wrong, they're entitled to those claims in terms of the Constitution as well, in terms of human rights and all those things. So if you have a backlog of claims already, and then you produce a system that's overloaded and overworked, where there's poor infrastructure, where there's poor human resources, and then you expect that system to work efficiently, obviously you're going to see that you're building a system that is going to eventually collapse. If it doesn't collapse from the beginning because of already you are indebted, then it's going to collapse eventually because it's going to be overworked and overloaded without improvements in the service provided. So this is where the problem of medical negligence is. So there has to be a system in place to settle the with current claims, and a system put in place so that if there are future claims, there could be a way of actually managing this in an efficient and cost-effective manner.
Dr. Anaban Pillay,
that's what I think in terms of this.
Let me bring you in on this conversation. Do you concur with the professor in terms of the backlog? We're also talking about the retention of skilled workers here in South Africa. Is there a retention plan in place from the Department of Health in order to keep the skills here?
Yes, there's a huge plan to increase the number of human resources in the health professions, and that includes producing more people, retaining the people that we currently have. They may not necessarily be employed in the public health system, but under the NHI they will all be part of the system in terms of service delivery. Coming to the issue of medical legal claims, it's a huge challenge. The first challenge is that clearly the legal profession has used the medical legal system in order to be able to extract significant charges out of the system. So part of the medical legal claims relate to what lawyers have identified as an area where they could pursue. We have introduced legislation that is now going to deal with this matter more effectively, largely because in many cases we have found that there are fraudulent claims from legal representatives where there has been no malpractice, but simply because the public health system didn't have the appropriate records, we find that these claims are presented to us. So staff, for example, at public health facilities are bribed to actually steal files in order to present it to legal representatives in order to claim. Having said that, on the side where there are legitimate claims, the approach we've taken is that these legitimate claims must be directly settled with the claimant rather than involving lawyers and other legal representatives that may represent the patient and compensate the patient appropriately where there is malpractice.
Gentlemen, I think we'll need a whole day, probably a whole month, to unpack the issues of the healthcare system. But thank you very much indeed for your insight. You've given us, made us aware of some of the challenges and some of the positives that we can expect with regards to the NHI that's kicking in the next couple of years. The process has started. So we'll be keeping on top of things with regards to that. That was Dr. Anaban Pillay from the National Health Department and Professor Sylvester Chima, Medical Ethics and Law and human rights academic. Thank you very much indeed for your time.